We chose to do the chapter on glioblastoma in Henry Marsh's Do No Harm book of his stories about brain surgery. Henry Marsh is one of the most highly acclaimed neurosurgeons there is. He is now 68 years old and technically retired, though still working 1 day a week for the NHS while living in London. A man who believes in euthanasia, he keeps a suicide kit in his home at all times compiled of pills he has gotten over the years that he knows would do the job if needed. He is a man who likes to control his own destiny. This is similarly proved by him switching career paths entirely when he entered into medicine. Marsh originally had studied politics, philosophy, and economics. He decided to become a neurosurgeon after witnessing his 3-year-old son have a brain tumor removed. His background in philosophy helped astronomically when it came to him wanting to write a book about his experiences. Writing it came naturally to Marsh, as he had kept journals since childhood. This is one of the great contributors to medicine, and we are lucky to have his writings of his experiences.
We are going to begin with the presentation of the clinical case of David H. The patient demographics are that he is a male over 6 feet tall. He was in his early 30s when first operated on, so we can assume he's now in his mid-40s. He was an athlete, father, and husband. The symptoms he had were progressive hemiparesis, which is paralysis of one side of the body, increasing drowsiness, and he did become unconscious at one point. The diagnostic workup was that David was operated on 12 years prior for a low-grade astrocytoma on the right temporal lobe. After 3 years, follow-up scans showed the tumor was back. He was operated on twice more and given radiotherapy and chemotherapy. He was given high-dose steroids, and a brain scan was completed upon his current hospital entry. His prognosis is very poor. His initial tumor developed into a glioblastoma and will be fatal within a few months. No further curative treatment is recommended.
Now we're going to discuss the tissue types that are affected by glioblastomas. Glioblastomas attack and infiltrate brain tissue in the central nervous system. They primarily arise from and affect the glial cells within the CNS. In David's case, the tumor initially attacked the right hemisphere's glial cells, specifically the right temporal lobe. The normal occurrence of glioblastomas arise in one of the 4 lobes. These lobes comprise 61% of all cases of glioblastomas, with the frontal lobe being the most common and the occipital lobe being the least. Glial cells are broadly distributed throughout the brain and spinal cord, so once infiltrated, the disease can spread quickly. The image to the left shows a patient with a glioblastoma on the right hemisphere of the brain, and the image on the right shows a healthy brain.
The area of the brain affected is the right temporal lobe. The image on the left shows where the right temporal lobe is located in proportion to the rest of the brain. The image on the right is an MRI scan that shows a glioblastoma present in the right temporal lobe of the brain. A glioblastoma in the right temporal lobe of the brain can cause difficulty speaking and understanding language, along with short and long-term memory problems. It can also cause problems with vision, depending on if the glioblastoma is compressing the optic nerve or not.
During his 3-year follow-up scan, it was determined that David's original tumor had become malignant and developed into a glioblastoma. Although his intellect and understanding were still intact, the tumor had become cancerous and burrowed deep into his brain. At this point, dying was inevitable. Because further treatment would only give David an extra month or so to live, he decided to undergo palliative care. From this case study, our group learned that glioblastomas are high-grade tumors of the brain and prove to be fatal. Glioblastomas result from the malignant growth of astrocytomas, a species of tumor within the brain, and radio and chemotherapy can be used to temporarily treat glioblastomas, but most individuals cannot be cured by surgery. Unfortunately, it can be assumed that David passed away from this case.